On this episode of the Ask Mike Reinold Show, we talk about how we use pain education in some of our athletes.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am joined by Dan Pope, Lisa Russell, Dewesh Podell, Lenny Macrina, Dave Tilley, answering all your questions from Champion PT and Performance up in Boston, Mass. Really appreciate all the great questions. Again, I think, as we go through these, we continue to just always say that it's humbling to see all the great questions and how many people watch this and listen to this on iTunes and Spotify. So keep them coming. If you have a question, head to mikereinold.com, click on my podcast link, and you can fill out that form to answer a question. Lenny, what do we have for students today?
Wow, we've had these students for a long time now, many weeks, and they are just an amazing crop of students. In the background, we have a Mike Scaduto appearance. We don't allow him on the podcast anymore. He's working. He just disappeared. We have Brendan Gates in the middle from Duke University. We have Jonathan Sandberg from Creighton University. And we also have Joey Scambia from Rhode Island via New Jersey.
Making his introductory first episode question, right, Joey?
Oh,
that's awesome. How does that make you feel?
Muted. That's how it makes him feel.
All right.
There we go.
Strike one, Joey. keep going. I like it, though.
All right, so we have Rachel from Philadelphia. Hey, gang. How important is pain education with working with athletes? When an athlete is worried about an injury, what do you guys focus on when implementing patient education? As a former athlete, I was always worried about not keeping up with my team due to an injury. How do you manage your athletes who have similar feelings?
Awesome, Rachel. Good question. And you kind of went down a couple of paths right there. Kind of thinking about this and how to frame this for us to answer here, because you talked about pain education, and then I think you talked a lot about almost like self-confidence and maybe some of the other psychosocial aspects of being injured as an athlete, which I don't know if I would put that together with pain education. But I know these are popular topics on social media right now. So I think it would be pretty good to kind of tackle a little bit. So why don't we start a little bit? Why don't we divide it into two halves, maybe, team? We'll talk about, pain science education in general in athletes and what that may mean in an athletic setting. And then maybe we talk about obviously the psychosocial aspect of that a little bit, because I think that's kind of what Rachel wanted to talk about a little bit, because obviously everything's related, right? That could obviously make your pain feel differently, right? If you're completely depressed and feel left out of the team and stuff like that. I think these are huge aspects of sports injuries that we're not really talking about as much as we should. But let's talk a little bit about pain education, because I think that's how you started this off, Rachel. Dan, you want to start off with in an athletic environment, what is the role of pain science education?
Yeah, this is kind of a challenging question just because there's multiple elements there, right? So we're talking about sports psychology and we're talking about pain science education, and I think the thing about pain science is that it's kind of encompassed everything, right? So people think about pain science, they think about therapeutic neuroscience education, they're thinking about maybe the psychology of the patient, they're thinking about cognitive behavioral therapy, mindfulness kind of pops up, and they all kind of are presented together in some of these research articles too. So I think that makes things a little bit more confusing. In terms of my education from a pain science perspective, it's mostly from Adrian Lowe, therapeutic neuroscience education. And I think a big thing for athletes is that they have to understand some little bits about pain if it's altering their behavior in a negative way, right? I think you tease out a lot of this in the subjective. And Jonathan and I were talking about this the other day. You have someone who comes in and you get an idea of their behaviors and their beliefs from the subjective. And I think at one point, Jonathan asked something along the lines of, what are your thoughts on movement? Are you fearful of movement, right? Because you know that that's a bad thing. A lot of athletes, when they have pain, they can do one of two things. They can blow through the pain, A, or they can completely back off and be very fearful of movement. But if you have an athlete that comes in and says, like, my hamstring's killing me, but I'll still practice 100%, they're just blowing through that pain, then they need to be educated that you have to build some trust with your body, right? But if you have someone who's not doing anything and they're very fearful of movement, you have to do the opposite. You have to tell them it's okay to move and show them how to do that. So I think from the pain science education standpoint, you may give them some information about pain, how that processes in the body. But the main thing is to try to individualize that to the person to make sure that they are on board with the plan of care you're going to give them.
That's huge. That's huge. And I like how you kind of, I like how you kind of put that together too, because I think a lot of times, like, part of what we do is to help them rebuild self-confidence in their limb or whatever their injury may be. Right. And we often do that, like in the physical therapy world, we talk about this internally as like that, graded exposure to some activities. So that way they can keep getting some self-confidence. Right. And we say that to our athletes all the time. It's like, the first time you do something, you're probably going to be like a little skittish with it. You may be a little nervous, but then, sometimes it's subconsciously, you don't even necessarily know that you're thinking this, but in your head, you're like, you know what? I did okay with that exercise. It's okay. And the next time you perform it, it goes much better, right? We had that with a throwing program about a month ago. One of our athletes came in, started throwing, and was just like throwing it straight into the ground, then hit the ceiling and broke somebody's windshield out in the parking lot, right? Like, you're right. So we just had him, we say, hey, calm down. We're going to be okay. We're going to just throw into this little net until you get a little confidence in your limb. And then boom, 2 weeks later, the students can't even catch him anymore. He's progressed so fast. So good example of that one. I like that. What else? What else you guys think? Dave, what's your experience?
Yeah, I think Duesh and I have a really good example we're kind of working on together right now. And it kind of comes into the other side of the question, which was kind of about like, athletes feeling like they're not part of the team. They feel as though, in my opinion, a lot of times athletes feel as though like they're at this super high level of training. They're really fit. They're pursuing their goals. They have this awesome kind of path. They get injured and it really knocks them down the ladder in terms of like what they feel their work capacity is. And kind of like they miss that feeling of being an athlete. And so we have an athlete now we're working with that is a super high level gymnast. She has a really big scholarship kind of coming next year. And she had a big surgery, a really big surgery. And so she feels kind of deflated about like, she feels out of shape. She feels like she's missing out. She's worried about what she's going to look like when she goes to school as a freshman next year. And I think this is an opportunity for us to, educate obviously on why we have to go slow. Like she had a huge surgery. So it's like 3 months out and she still has precautions, right? So it's like, listen, they literally broke your limb and reattached it. And like, it's a reason why, you have to go slow. But at the same time, I think this is why some of the things we have to our tools of advantage are, you can still get a really good workout if you know how to program around some of these precautions. And so she was kind of riding this boring rehab process until we could introduce BFR. I talked to her surgeon and I was like, hey, could we do it in a modified setting around the protocol? And he was like, it sounds great. And that first day, she kind of got like crushed in a good way, where she's like, oh man, my quads feel sore. My hip feels sore. I feel great. She's sweating. She's in there for 3 hours. She's working her butt off between Dewey and I. And I think that was a really big kind of hurdle to get over, where she felt as though she was really behind the curve. But then also as she started training with Dewey, and like just yesterday, he's given her these massive upper body sets where she can obviously be safe for her lower body, but she's kind of killing herself in a good way. And she really got a lot of like, positive feedback back, because she's not with her team. She's not working. This girl's training 5 hours a day, to get where she wants to go. And so she doesn't have that anymore. And I think this like finding creative ways to make them feel like an athlete still and make them work out, especially around you can train 3 limbs very, very well. I think that's massive for people to really hang on to.
Yeah. And that's going to put her in such a different frame of mind that, like, who knows, maybe her ability to cope with some of the discomfort is lessened a little bit because she's in a better frame of mind and able to handle a little bit. Like, yeah, no, of course her injury is going to be painful, right? But sometimes it's about how your brain accepts that pain and then, determines what you're going to do. Are you going to lay down and just try to rest, or are you going to try to gradually try to improve yourself? Great stuff. What else, Dan?
All right, I got so much to say about this. I think it's a very nuanced thing. One of the big problems athletes face is all this pressure from their team, from their self, from their coach in terms of performance. And sometimes that's really legit. I can think of a rugby player I was working with the other day and basically strained his hamstring. And if he doesn't go to practice and perform, the coach doesn't care. He's just going to cut him and he's not going to play, So then he's in this really tough predicament where it's like, well, what's the best thing for you? To back off, right? You need to back off for, the best chance of this thing to heal. He doesn't necessarily have that ability to do that. So for a lot of athletes, I think they feel that tremendous pressure. And what Dave was talking about is that, for most athletes, especially higher level athletes, a huge sense of their self-worth is all wrapped up in their ability to be an athlete. And when they get hurt, they feel like their entire world has kind of gone away and their teammates don't care about them, their friends don't care about them, the coaches don't care about them. Sometimes that's accurate, right? There's a lot of coaches out there that when there's an injured athlete in front of them, it doesn't mean anything to them. Like, get this athlete out of my face. So I do think, and this is a very challenging thing to create, and Dave can probably talk on this a lot better, is you need a culture of acceptance. You need to have a coach, an athletic trainer, physical therapist, and the athletes to understand injury. When injury happens, the best course of action to get someone back is not to keep push, right? Sometimes maybe you need to push. But if there's not that culture of acceptance, then the athlete's always going to feel all of this pressure when they have an injury to try to continue pushing, right? Or feel that stress from their team or whatever it may be.
Yeah, it stinks that people feel that way, but I think that's, I think that's common, right? And I think that's probably more common than we think, because a lot of people just stuff those feelings down sometimes, right? I'll give an example. I had a few athletes just in the last month, and honestly, a few. I think that the biggest thing I did for them in my treatment session was evaluate them and tell them that, look, I ruled out all the things that we should be worried about. Like, meaning like, oh, you have knee pain. Okay. And you're worried. Like, here's a good example. Let's use an actual example. He's a catcher, a baseball player. He's a pro ball catcher, right? He tore his meniscus years ago. I don't even remember, 6-7 years ago, he tore his meniscus in one of his knees. All of a sudden his other knee started getting a little sore and his brain went, boom, this feels just like my last injury. Now his last one was traumatic. It was like a pivot, a shift in the sand, pop, bucket handle, meniscus tear. It was a big deal, right? This one was just one day he was like a little sore and a little puffy. He's a catcher. He's a pro ball catcher. He's been doing this a long time. And he totally was nervous that I did it again. I tore my other meniscus. So my exam and my treatment was ruling out all the bad things. Like, hey, your ligaments look good. I don't think your menisci look that bad. And then that is going to lead to the best chance of recovery than actually anything I physically did with them. Right. What else, Lisa?
Yeah. I mean, I completely agree. I feel like having someone understand how they're feeling and why they're feeling that way is like super powerful. And like teaching them how to even discern that for themselves of like, okay, is this pain that I need to worry about? Or is this pain that like is just a part of training and like, I'll be cool. I have a rower right now who was super fearful of getting back on the water after like a back injury and everything. And I think the biggest thing we did was talk through like expected, return to sport soreness versus bad pain versus, all those things. And it was great. She came in the other day and even told me like a few of her teammates were complaining about like this thing hurting this way or that thing hurting that way. And she felt like she was like able to tell them like, oh no, that's normal. Like, you just got back on the water versus like, you probably should go see someone. It was a neat moment because she got it. She's getting it anyway. Right. That difference of like training versus bad pain. And like you are at risk of doing something that's going to pull you out for X number of months, if you ignore it versus like, yes, you're back sore because you just started back on the water.
Yeah. We deal with that all the time with our return to sport athletes too, right? Is they start running, they start jumping, they start throwing, whatever it may be. And they're like, oh, it's a little achy. Is that normal? Some of them completely panic. Some of them know how to put the blindfold on and just proceed. To be honest with you, both ends of that spectrum are probably equally as potentially bad, right? So we got to be careful with that. So I'll end it with this. And I think this is a good way to end it here. A lot of times when we talk about pain education and pain science, we talk a lot about nocivic effects and some of the negative that we can do with some of our terminology and dialogue with our patients and our clients. I think what we just talked about there was a completely different way to reframe it, right? We just talked about a positive way, not a negative way of being sure that we're talking about pain with our athletes, right? And I think that's an important concept and a different slant to the way you do it. Because think about everything we just said. We just talked about how we're trying to educate people to realize that, yes, they have some pain, but we will help you get through this a little bit. So a lot of things that get shunned right now on social media, things like modalities, manual therapy, stuff like that. So I don't know, heat, ultrasound, e-stim, soft tissue massage, vibration, all these things. Some people just say like, oh, and you're doing a disservice to your client. Well, if my person's nervous about getting out there and doing an exercise or a sport activity, I'm going to educate them on why we're going to slowly get to that. And I may do things like modalities and manual therapy to get them to feel better. So that way, then when they go out there, they have less fear in their limb, right? I think that is a crazy way of sometimes people take it too far and say, all we should do is just graded exercise with people because that's all they need. That might be all they need, but that doesn't mean the other things aren't helpful for getting them to accomplish those tasks. So I'm not sure if I articulated that completely well. I mean, I know we got to kind of wrap up this episode a little bit here, but I think, man, as I listened to everybody talk, it made me think like we're dealing with people with fear, anxiety, some, like, I don't know if depression is always the case as it's probably more common than people ever tell us, right? It's like people say I'm in pain or I'm fearful sometimes, but people don't say like, well, I'm down about it, right? I feel bad. We talk about that all the time, but some of these things we do, touch modalities like our manual therapy, can really help lift those people up. So just keep that in mind. There is some positivity to some of those things and how that may impact somebody's pain and their psychosocial outlook. So that way we can get more out of them and get them back on the field, right? Makes sense. So awesome question. Great tackling. And I think everybody had some good thoughts on this one. If you have more questions, head to MikeReinold.com, click on that podcast link, fill out the form to ask away, and be sure to keep catching us on iTunes and Spotify. See you on the next episode. Thanks.